Hello. It is now 12 p.m. Eastern Time. You have joined the 2020 Justice and Mental Health Collaboration Program Orientation Part 1 webinar. To allow for additional sign-ins, we will start the webinar in about a minute. Good afternoon. Thank you for joining today's 2020 Justice and Mental Health Collaboration Program Orientation Part 1 webinar. Today's webinar is Part 1 of 2 required orientation sessions and is focused on an overview of the Justice and Mental Health Collaboration Program, or JMHCP. I am Demetrius Thomas, and I oversee the JMHCP Training and Technical Assistance at the Council of State Governments Justice Center. I will be moderating today's webinar, which is hosted by the U.S. Department of Justice Bureau of Justice Assistance, BJA. To give you an overview of today's webinar, first we will do introductions of our panelists and then discuss an array of resources and available to support diversion and reentry practices. Next, we'll hear from BJA, who will provide an overview of the Justice and Mental Health Collaboration Program, or JMHCP as we usually say. We will also provide information about the technical assistance process for grantees, and toward the end of the webinar, we will have time for questions and answers. Anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to go through as many questions as possible, time permitted. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues that we may not be able to resolve. We are recording the webinar and will post it on our website by the end of next week. Our speakers are Dr. Aisha Delaney-Bruncy, Director of Behavioral Health at the Council of State Governments Justice Center. Dr. Delaney-Bruncy oversees the Behavioral Health Division at the Council of States Government Justice Center, which focuses on reducing incarceration of and improving outcomes for people with behavioral health conditions. Before joining the organization, Aisha was the Director of Behavioral Health Research and Programming at the New York City Mayor's Office of Criminal Justice, which she helped to advance a number of reforms, including increased investment in the city's crisis response services and supportive housing for people with a history of justice involvement. Prior to that, Aisha was the Director of the Substance Use and Mental Health Program at the Vera Institute. Our second presenter or speaker, Maria Fryer, Justice Systems and Mental Health Policy Advisor at the Bureau of Justice Assistance, U.S. Department of Justice. Mrs. Fryer oversees the Justice and Mental Health portfolio and collaborates with the CSG Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of municipalities and the citizens they serve. Fryer previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crimes. Our third presenter is Sarah Wurzburg, Program Director of Behavioral Health at the Council of State Governments Justice Center. Mrs. Wurzburg leads the substance addiction portfolio and is a social worker by training. She assesses local and state behavioral health and justice systems to provide guidance to states involved in the Justice Investment Initiative. She oversees training and technical assistance, or TTA, for the Second Chance Act behavioral health grantees. Previously, she oversaw the TTA for Justice and Mental Health Collaboration Program grantees and provided TTA to state addiction agencies at the National Association of State Alcohol and Drug Abuse Directors. I am Demetrius Thomas, the Deputy Program Director, and I oversee here at the Council of State Government Justice Center, and I oversee the Justice and Mental Health Collaboration Program Technical Assistant Grantees. Prior to joining the Justice Center, I worked at the New York City Department of Health and Mental Hygiene, where I led several initiatives at the intersection of criminal justice and mental and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis team. I want to thank you all for joining today's webinar. I will now turn things over to Maria Fryer, who will talk a bit about the Bureau of Justice Assistance.
Thank you, Demetrius, and good afternoon, everyone. My name is Maria Fryer, and I'm a policy advisor for the Justice and Mental Health Collaboration Grant Program, or JMHCP, in the policy office at the Bureau of Justice Assistance, also called BJA. And I've been at BJA now just over 6 years, and I have a long work history of program administration at the state and local levels. And I come from many of the community programs that you represent here today. And I look forward to working with all of you to make your JMHCP grant a success. So we have to open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing grant funding in a very competitive year. Your applications were screened for basic minimum requirements, were reviewed, rated and scored by panels of external peer reviewers, and after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So congratulations on your award. So a little bit about what our expectations are of you. And since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations that we have of you. So we expect that you will think about your systems and how they could be more responsive to people with mental illness and co-occurring substance use disorders in the criminal justice system, that you will take on the planning process and work closely with your TA coach, because these programs are really making a difference at the local level. And you will use validated screening and assessment for mental illness, substance use, and criminogenic risk, and that you will seek appropriate services and identify system gaps for serving people with mental illness. And finally, that you will seek help when help is needed and communicate regularly with your technical assistance coach and BJA staff. You will have a state policy advisor from our programs office who will help you with budget and grants management, and I will help, of course, on the policy side. So what can you expect of us? You can expect that we will support you and assist you as you set out to reach the goals to enhance your systems and reach all of your program goals. We want you and your staff to have the necessary tools to serve this critically underserved population to help your communities. So we provide quality technical assistance through our program partners, the Council of State Government's Justice Center. And I just want to say a few words about the Justice Center. They really brought to light back in 2005 the need to better serve people with mental illness through the justice system in their landmark consensus project. And this was quite some time ago. They've been with JMHCP since its inception and been a partner with BJA for a very long while, so you are in really great hands. Each of you will have a technical assistance coach assigned to you by the CSG Justice Center, and we expect them to call you, to email you, to challenge you, and to support you. So a few words about the Bureau of Justice Assistance. At BJA, our mission is to provide leadership and services and grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crime, and combat victimization. Through the development and implementation of policies, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. So within BJA, I work at the policy office as a policy advisor for justice systems and mental health. I oversee a number of programs pertaining to the intersection of mental health and co-occurring disorders within the criminal justice system, including the JMHCP program and our law enforcement work. We are a small but dedicated staff and dedicated to translating best and promising practices into quality policies and programs for the criminal justice field. Also within BJA is the Programs Office, and the Programs Office manages the individual awards post-award that each of you have received, and as much as you have been assigned, all of you have been assigned a grants manager, either Nikisha Love or Tammy Lovell. Nikisha and Tammy will be your contact within BJA with support from Eric Dietrich, Division Chief, who can answer all your questions pertaining to allowable costs, management of the award, and reporting. And you'll hear from Nikisha and learn much more about their work on the second orientation webinar. We work very closely together to ensure that all JMHCP grantees remain on track with their awards. So with this brief introduction, I will now turn it back over to Dr. Aisha Delaney-Brumsey to talk a bit more about the CSG Justice Center, the history of JMHCP, and provide critical context about people with behavioral health needs in the criminal justice system. And you'll hear a little bit more from me later. Aisha?
Thank you so much, Maria. Really appreciate that and for your kind words earlier. And of course, thank you to BJA for the Bureau's continued support of this work. I just want to echo the congratulations that Maria just gave. We wanted to say true congratulations to all of you for this award, and we're really excited to be working with you on it. So for those of you who are not familiar with the Justice Center, we're a national nonprofit that works with hundreds of communities across the country to improve their justice systems. This includes communities like yours that are working to improve outcomes for people with behavioral health conditions. Next slide. And we really do this by bringing together people across sectors, across political affiliations to implement data-informed policy and practice changes. Next. And this includes the technical assistance that our team here at the Justice Center will be providing to support your efforts through Justice and Mental Health Collaboration Program, which funds innovative cross-system collaborations to improve public safety, individual health, and to reduce incarceration for people with mental health conditions or mental health and co-occurring substance use disorders. Next slide. The challenge that you'll be tackling through your JMHCP awards, the disproportionate contact and worse outcomes of people with behavioral health conditions in the system, is one that communities across the country are facing and working to address. Next slide. Indeed, one of the seminal research papers on this topic found that the rate of serious mental illnesses in jails was 3 times higher than that in the general population. And this data has been confirmed time and again in both local as well as national data. Next. What we know is that this disproportionate incarceration in jails is reflective of challenges at each point along the criminal justice system. Beginning at front end with law enforcement, where we know that calls for service for people in crisis are particularly challenging to respond to effectively and compassionately, which is why so many law enforcement agencies, many of which we've had the privilege to work with, and their behavioral health partners have implemented specialized police mental health collaboration initiatives, from mental health training to co-response teams, crisis stabilization units, and many others, all focused on safely reducing law enforcement contact and connecting people with health and social services that reduce the likelihood that they come into contact with law enforcement in the future. And what we've seen from communities is without those initiatives, officers are really often left with few options other than arrest or transporting someone in crisis to the emergency department. Next slide. Looking further downstream to the courts, we know that the decisions judges make also contribute to this over-incarceration. Indeed, in a survey that we conducted with North Dakota judges, We found that nearly 3/4 reported sentencing someone to incarceration as a means to connect them to mental health treatment. Next. And we know that it's not just the fact of disproportionate incarceration that jurisdictions like yours were contending with. We also know that once incarcerated, people with behavioral health conditions often face worse outcomes that people who are also incarcerated do not face, including higher rates of suicide and self-harm, or less likely to face, truthfully, including higher rates of suicide and self-harm, exposure to trauma and violence, and longer periods of incarceration. Next slide. And finally, even once people do return to the community, they're often met with gaps in the types of mental health treatment and supports, such as housing, which have been shown to reduce the likelihood that they come into contact with the system in the future. All of these challenges and many more are what you in this virtual room are looking to address, and we really applaud you for that work. And as I said at the top, we're excited to support you in your efforts. So thank you very much, and I will go ahead and turn this over to Sarah Worsford.
Thank you so much, Aisha. You really helped set the stage for some of the issues that we are facing nationally that our grantees are primed to tackle. Next slide. So grantee team members in attendance today may be thinking about the different areas in which their project is funded to support. It could be a law enforcement focus that may consider the types of approaches that will work best in their responses to calls involving people with mental illness or co-occurring substance use disorders, or how best to help high utilizers of multiple service systems decrease their future law enforcement jail contact, as well as emergency room visits to lower the risk of rearrest. Other teams are considering, how do I effectively identify people in their jail or court systems who have mental illnesses, or support successful reentry back into the community. Through the support of the training and technical assistance, or what we'll call TA for short, the TA coaches will help you dive in and grapple some of these critical issues. Today, we'll share some of the resources that we've developed as a part of our training and technical assistance to Justice and Mental Health Collaboration Program grantees. So really, we've taken some of the challenges that we've heard from grantees over the past decade and tried to develop resources to directly address those key challenges that are facing grantees in the field. One way we're addressing this work is to really think about what are jurisdictions asking about diversion, and what does the collaboration look like across the criminal justice systems. We're looking at the justice system as a whole and really thinking about the opportunities to design and implement different strategies to address mental illnesses and substance use disorders throughout the system. So really looking at different areas in which behavioral health needs can be addressed, as well as considering who is eligible for pre-booking and post-booking diversion options that can be supported by law enforcement, pretrial services, the courts, and the jails to successfully get people access to community-based services from the justice system. Next slide. This chart really provides a visual of that flow of people with mental illnesses and substance use disorders in the justice system, and opportunities to divert people out of the system that can be led by the different areas of the system, from pre-booking and post-booking diversion. Along with thinking through behavioral health diversion strategies, it is important to think through the continuum of care that might be available in the community. So treatment, different services, housing or supportive housing opportunities as well. We're working with grantees to take some of this thinking to responding to how to screen, how to assess people, how to provide evidence-based treatment for behavioral health needs, and how to really shift from one program in the community to thinking through a systems-wide strategy to address some of these issues. So to that point, we actually developed a short document that has a framework for behavioral health diversion strategies to really think about how to move to a multiple systems approach. So how to really coordinate across law enforcement, across courts, across jails, across probation, or as well as the prison system and parole, to really think through what are the options across the system to help divert people to community-based services when appropriate. It really thinks through developing and engaging collaborative partnerships, understanding the community's behavioral health needs, identifying existing services and supports, looking at gaps, defining key measures and data collection strategies, as well as leveraging funding to prioritize some of these interventions, and then measuring and sustaining progress. So some of these issues are issues that you've already thought through as you are getting to apply for these grant programs. So previously, Aisha mentioned police mental health collaborations, and this is really a national level effort to address pre-booking diversion strategies through a resource called the Police Mental Health Collaboration Framework. So this framework outlines core components to address the PMHCs that produce improvement for community-wide outcomes. It's really also about moving from the small scale to training agency-wide efforts to really holistically address mental illnesses and co-occurring substance use disorders for law enforcement agencies. The Police Mental Health Collaboration Framework is a resource that's intended to support the 18,000 plus law enforcement agencies and assist local leaders, including elected officials, law enforcement and behavioral health agency executives, and their senior personnel who want to begin or improve the existing outcomes for the police mental health collaboration programs. The framework is focused on 6 questions for law enforcement leaders that focus on leadership, protocols, training, resource and service coordination, data, quality assurance for improving performance. For those of you who are law enforcement focused grantees, you'll get familiar with some of the police mental health collaboration program as we discuss it in some of the learning communities and through your work with your TA coach. In addition to the effort for the police mental health collaboration program, BJA has a total of 10 law enforcement mental health learning sites. The technical assistance available from the law enforcement and mental health learning sites includes calls, emails, site visits, training, and presentations. They're a really great resource of national group of leaders who are really leading the way to address police mental health collaboration programs. And as grantees, you might be very interested in connecting with some of these learning sites, and your TA coach can help facilitate that connections to these on-the-ground leaders and best practices who will really help you and support you in additional ideas to implement a police mental health collaboration program. So as you can see, and as we mentioned, there's 10 police departments that have been selected, which are located across the country in urban, suburban, and rural jurisdictions. The learning sites represent a diverse group, a cross-section of perspectives and program examples that are dedicated to helping other jurisdictions improve their responses to mental illness and co-occurring substance use disorders. Another initiative that has been developed is called the Stepping Up Initiative, which is a national initiative focused on reducing the number of people with mental illnesses in jails. Since May 2015, over 500 counties have stepped up to address mental illnesses in jails. We know that many of the grantees potentially reference this in their application for the Justice and Mental Health Collaboration Program, and that some of you are a part of Stepping Up Counties, and we hope that the TA that we can also link to some of the Stepping Up resources to better support your efforts. The Stepping Up team focuses on a no-nonsense, data-driven approach to public management with steps that will be worked on other jurisdictions, such as the development of a shared definition of mental illness and serious mental illness, using data to quantify the problem and tracking progress. The Stepping Up approach is based on 6 questions and 4 key measures to simplify the hard work of reducing the number of people with serious mental illness booked into jails through shortening the average length of stay, increasing the percentages of connections to care, and lowering the recidivism rates. The 6 questions framework is focused on thinking through the baseline data, screening and assessment processes, process analysis, inventory of services, prioritizing policy, practice, funding, and tracking progress as people try to address this issue in their systems. Through work with grantees, we have seen that for systems across the country, it can be difficult to use data consistently. Data-informed decision-making is tough, and identifying people with mental illness and co-occurring substance use disorders in the justice system is also a hard thing to undertake. Through the JMHCP, a key focus will be working with you to have accurate data collection and information on people with behavioral health needs in your systems. Other challenges that we have heard from grantees and from working with sites around the country include identifying systems improvement and treatment gaps in the criminal justice system and the community. In particularly, there are high utilizers of costly services such as police, emergency rooms, crisis housing, inpatient care, jails, and homelessness services in most jurisdictions, and has tended to be a big focus for many of the grant jurisdictions. It is challenging to identify, track, and connect with these high utilizers that will lead to positive outcomes, such as increased public safety, decreased recidivism, and behavioral health recovery opportunities. This goes back to the concept of where to focus the diversion strategies, which can also look different depending on your community. At the practice level, there are some additional challenges in working to balance the criminogenic risk and behavioral health needs across the systems and jurisdictions to really support people with behavioral health needs. This can also include creating a consistent feedback loop to support data and information into practice, as well as the implementation of evidence-based practices and fidelity using implementation science. The development of quality assurance practices for screening, assessments, the evidence-based treatment, and training initiatives are common focuses that many of you will be undergoing as part of your grant process. So we look forward to supporting teams on these issues as well as throughout the cycle of your grant. So I mentioned a little bit about criminogenic risk and behavioral health needs. So there's a framework on the slide that was developed to help jurisdictions really think about this and really thinking through how to use screening and assessments to identify potential eligible participants for different programs, to differentiate between the treatment and supervision options. So really starting with the criminogenic risk level, and then going to think through the level of and severity of substance use disorders, followed by the severity of mental illnesses. So really looking at the justice, the substance use, and the mental illness potential for different people who you might be able to serve. Next slide. To really try to capitalize on how to take this information and bringing it into practice, we developed a web-based tool called the Collaborative Comprehensive Case Plan Tool, which is meant to support addressing criminogenic risk and behavioral health needs in a balanced way. The goal is to identify a lead case planner, whether that be a behavioral health provider, someone from corrections or community supervision, or another social service support provider. And there are 10 key priorities that are walked through to think about how to best case manage someone with behavioral health needs in the justice system. So this is an example of the lead case planner. As I mentioned, the lead case planner can be from very different agencies depending on your initiative. But really, the goal is to think about the different providers that might be helpful to connect with as a lead case planner. So receiving information from peer support specialists, participants, housing, as well as different information that you can receive from other providers in the community who may also be working with your program participants. There's case studies on our Collaborative Comprehensive Case Plan website that also provides information from 3 jurisdictions who are best practice sites. There's also additional information on relapse prevention planning. If you're planning to address co-occurring substance use disorder, this can be a critical piece of the puzzle for you. You can go to the web-based tool and click on any of those different fields to be able to get additional information. I'm now going to turn it back over to Maria, who will give an overview of the Justice and Mental Health Collaboration Program grant program.
Great. Thank you, Sarah. So on to the grant program itself. The goal of the JMHCP grant program is to develop collaboration across criminal justice and behavioral health systems, from law enforcement, pretrial, courts, jails, and community supervision, to learn how to have successful partnerships that increase efficiencies and improve public safety and outcomes for people with mental illness or co-occurring mental illness and substance use in the criminal justice system. Next slide. Nearly $164 million have been awarded through the JMHCP grant program to improve public safety and responses to people with mental illness and co-occurring disorders in the justice system. We were excited to have an increase in funding for this year and each year for the last few years. Next slide. There have been 568 awardees from across the nation representing 49 states and 2 U.S. territories, American Samoa and Guam. We are proud to have worked around the country to support local programs. Slide. This year, there are a total of 29 new grantees, 16 Purpose Area 1 embedding clinicians in law enforcement agencies, 9 support for mental health centers, and 4 mitigation threats of targeted violence. We have people working throughout the justice system, local law enforcement agencies, pretrial, courts, jails, and probation and parole, all in partnership with their community-based behavioral health providers. I will go over a bit about each grant purpose area, but stay tuned for even more information during the grant purpose area orientation webinars in December. So a little bit about objectives and deliverables. All awardees will work under a 2-phase process. The first is planning and the second is implementation. The planning phase will take up to 12 months, and during this phase, you'll work with your TA coach to complete your respective purpose areas planning and implementation guide, which will be discussed a little bit later. Next, on objectives and deliverables, up to $100,000 can be used towards the planning phase. Once BJA and the TA coach have approved your planning and implementation guide along with the programs office, then the implementation phase will begin. The performance period for all grantees is 36 months. So on to embedding clinicians in law enforcement agencies. This purpose area allows for social workers and mental health professionals to be placed in a law enforcement agency to assist officers during encounters with people in mental health crisis. Purpose Area 2 funds operational expenses for centers to provide assistance to those who serve mental health needs or are at risk for recidivism. And Purpose Area 3 supports law enforcement and prosecutors to respond to and mitigate threats of targeted violence. So now I'll turn things back over to Demetrius for the next topic we'll cover today, which is an overview of the JMHCP technical training and assistance.
Thank you, Maria. JMHCP's TTA provides each grantee with a TA coach for the duration of its program. Opportunities for peer learning, access to experts in the field, and further resources and tools. Each grantee will have individual monthly calls from an assigned TA coach, guided CTA through the P&I guide process, a purpose area-specific learning community, access to expert TA consultations with CSG staff and subcontractors who are subject matter experts in the field, and peer-to-peer connections, including learning sites and innovative counties, as previously discussed. The Planning and Implementation Guide was created in part to support grantees in developing and refining your initiatives, foster discussion on best practices, identify considerations for your collaborative efforts, and help you work through key decisions and implementation challenges, and to understand the status and progress of your project, the types of challenges you may encounter, and ways your TA coach might be helpful to you in making your projects successful. Each purpose area has its own P&I guide with questions specifically designed for its focus of work. The last part of your P&I guide is to develop your TA plan. You and your team should reflect on any areas of program development where you would be interested in receiving technical assistance. For example, refining your evaluation plan, training or supervising staff, developing a process and template to be used for case planning, and identifying sustainability areas. You and your team will work with your TA coach to develop the TA plan to include goals and action steps to help you move the grant forward and meet deliverables on time. Throughout your grant, you will work with your TA coach to review and update your plans. In addition to having learning communities for each purpose area, there will be 2 other learning communities, one on high utilizers and the other on data collection, information sharing, and evaluation. Led by both CSG staff and subject matter expert consultants, learning communities are have independent sessions and are opportunities to connect with and learn from peers and experts in the field. Finally, please subscribe to our monthly behavioral health newsletter using this display page to learn more on the goings-ons with the Justice Center and what is happening throughout the field. Now, we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can chat in your questions in the Q&A box at the bottom right-hand corner of your screen. Also, as we are taking questions, we will advance the remainder of our slides, which have information about the upcoming Part 2 orientation webinar, training date, and the purpose area specific webinars, as well as key references and resources, the presenter's contact information, as well as CSG's Justice Center newsletter write-up. Another reminder that this webinar has been recorded and will be posted along with this slide deck on the Justice Center website. We will now begin the moderated Q&A session for the webinar. So one of the first questions that we have is, when should we hear from our TA coach? Sarah, would you like to answer that question?
Sure, absolutely. So your TA coach will be reaching out to you in the next few weeks. So you should hear potentially definitely by early December, you will have heard from your TA coach, and they will introduce themselves to you and work to try to schedule a first call, an initial introduction call to your team.
Thank you, Sarah. Another question that we had was, are there standard data sets that are being used around the country? If not, are there suggested data sets that we are working to standardize? Sarah, would you like to answer that question?
Yes, I was about to jump in. So this is a really good question. And so there is standard requirements in terms of what you will be collecting through the Justice and Mental Health Collaboration Program, which will be discussed more on the second orientation webinar. It's called the Performance Measurement Tool. And so there's a set of required questions through the Justice and Mental Health Collaboration Grant Program. To your question about, are there additional metrics that we would recommend? Yes, so there are some publications of additional metrics that we can recommend. The Police Mental Health Collaboration Program has different metrics that are tracked. The Stepping Up Initiative has different metrics that are tracked. And we're actually working on developing a document that talks about more uniform program evaluation for Justice and Mental Health Collaboration Program grantees. And we expect to be able to share that in the next month or two with grantees. Another good resource that Demetrius briefly mentioned is we do have a data collection, information, and evaluation learning community in which we have a national expert, Dr. Faye Taxman, and we talk about some of the key metrics, how to collect things on that learning community as well. So to the grantee who asked that question, that might be something to flag of interest for your TA coach as well.
Thank you, Sarah. A few other questions have come up that I think I can address. One question is, when will we receive a copy of the Collaborative Comprehensive Case Plan Framework? That is available on one of the resources guides slide deck that has the link to that information. So once we send the slide deck out, you'll be able to go to that web page and download that information. Another question that we got was, if we previously completed a planning guide from another grant, we will need to do another one for this grant. Yes. That is that the previous planning guide that you specifically completed was specific to that P&A guide for that grant. As stated before, all P&I guides are very specific and have questions that are tailored for your specific purpose area. So if you are a grantee with the new purpose area, you will need to complete that new P&I guide for that purpose area. Another question that I think I'm going to direct to Maria. Maria, some teams are still experiencing challenges in accepting their award in just grants. The question was, can you provide any recommendations for this process?
So, yes, this is a new system, of course, and just like anything new, we're still ironing out some facets of this new system. And we have a website that we can provide to you that has a lot of guidance and a lot of FAQs, and we can definitely send that out just after this webinar to make sure that all the attendees have access to Just Grants website and additional information. I hope that answers the question.
Thanks, Maria. Another question that we had is, for the embedding clinicians into law enforcement, can you explain a little more of the role of a lead case planner? I'm going to direct that question to Sarah.
Sure, absolutely, and that's a great question because I think the context that we had talked about it was not clear. So I think part of that depends on how your program is set up, but for an embedded clinician in a law enforcement agency, what that might look like is that the embedded clinician at times would be your lead case planner. So oftentimes we have seen, whether they're embedded in a police department or if they're embedded in a jail, which is the focus of most of the grants in these categories, the embedded clinician potentially would be helping to manage the case management process across the behavioral health and justice stakeholders. So I would say that's how it most commonly would look in that case. But I think some programs might do it a little bit differently, so it might actually be a different stakeholder. But what we're really talking about there is really how that coordination looks like to make sure the handoff between the law enforcement and the clinical staff really is seamless and addresses both the potential law enforcement issue in addition to the behavioral health needs of the client.
Thanks, Sarah. Another question that we have is, when should we receive the P&I guide for your purpose area? You will be receiving the P&I guide at or around the time that you are scheduled to attend your specific P&I guide or your specific purpose area orientation, which will be given to you and followed up by your TA coach in that information email. Any other questions? Sure. Another question is, can you tell us more about the purpose area-specific webinars? As previously alluded to, the purpose area-specific webinars is specifically designed for the opportunity where you will be able to get to really dig into what your purpose area is about. It is an opportunity for you to be introduced and learn from the other programs that are under the purpose area. It is also an opportunity where you will be able to hear from other grantees who have been involved in the JMHCP TTA area. So one of the question is, who should attend training and technical assistant calls? Those calls should be attended, I would say, by all of the key grant persons on it, as well as those individuals who are on the supporting side of your grant. And if your grant has an evaluator or some type of evaluation team, they should be also included on your training and technical assistant calls. Another question that we have, I'm going to kick this one to Sarah. When should we start engaging stakeholders for this project?
So that's a great question. We know that many of you actually engage stakeholders when you're going through the application process, which at this point was over 6 months ago, so there might be some re-engagement needed. So I think right now most grantees are still working on getting the approvals through the grant, it sounds like through the Just Grant systems, and making sure they've accepted the award. But we would hope that as people get budget approval, they will start to have those conversations with the mental health and the justice system partners, and to really engage in advisory group and an implementation team as part of the Justice and Mental Health Collaboration Program project. So the advisory group would be larger stakeholders who might have budgetary authority in your jurisdiction, as well as some of the key team members. And then the implementation team would really be the folks who are going to be doing the on-the-ground work and oversight for when the actual program is through its planning phase and to support the planning phase of the grant.
Thank you, Sarah. Another question, if you continue, or a response to a question, if you continue to have issues with the Just Grant system that aren't being solved, for part 2 of the webinar orientation, we will be specifically focusing on the issues of, we will be focusing on the Just Grant system as well as the PMT. So there will be an opportunity to direct those questions to the programs team of BJA, who is better suited to address your specific questions and concerns related to the Just Grant system. Another question that we have that I think I'm going to kick to Maria. Maria, when should we expect to get budget approval?
Yes, that's always a good question. With each new cohort, there's definitely a process that we do go through to approve budgets, and it can take some time. So I know it takes a bit of patience, but so budgets would first go to the programs office post-award, and your policy advisor there in the programs office, your grants manager, would review your budget. And if they can see where you might need to make immediate changes, they'll reach out to you with those immediate changes. And then that might take a little while, maybe a few weeks, post-award. And then that budget will go on to OCFO, who also has additional questions. They'll send those questions back to the programs office, and then the programs office, again, your grants manager is going to be your primary contact post-award. So there's a little bit of a process where there's a back and forth until all those budget issues are resolved and all the special condition withholdings are lifted. And at that point, then your budget would be approved. And, you know, just full disclosure, it can take a little while. It can take, could take 8 weeks. If there are a lot of major problems to resolve, it could take a little bit longer. But the important thing to know is that you'll continue to work in an iterative process back and forth until everything is resolved and you're up and running. But you cannot incur cost until the budget is approved. So just wanted to say that it does take a little while. Have patience and definitely watch email and keep an eye on the communication with your grants manager and be, you know, responsive when they have questions, which can make it go a little bit faster. But it is a process.
Thank you, Maria. Another question to that in terms of the planning process. A grantee wants to know, does the planning process have to take the complete 12 months?
It can take up to 12 months, and then there is conditional clearance where you do have some access to some funding during that planning process. It can take up to 12 months, but doesn't necessarily have to take the whole 12 months.
Thanks, Maria. Any other questions? I think, Maria, this question is probably best suited for you. Since there has already been a delay due to the Just Grants transition, and it will be a while for the budgets to be approved, will there be an opportunity for a no-cost extension for our programs?
So we do want you to be successful, and we do recognize these challenges. I would just say that there is opportunity, but it is on a case-by-case basis. We would be, you know, wondering, you know, what is the situation, you know, and of course with the delay that's on our side, we'll definitely take that into consideration. But it is unique to each situation, each program, and what their needs and challenges are. But I can just assure you that we do want you to be successful, and we're going to help you to overcome those challenges. And a lot of it is grant process, and especially when there's a new process introduced, there's always delays. So we will take that into consideration.
Maria, one other question or another question for you is the budget approval process post-award notification?
Is the budget approval process post-notification?
Oh.
So you're asking, did I hear that correctly?
Yeah. So is the budget approval process post-award notification? So I guess the question is your budget being approved after you've received the post-award notification?
Yes. So the process does take place after you received your award notification, and then that's when it, you know, begins with the programs office, goes to OCFO, and then it kind of comes back to the programs office, and then communication is between the grants manager or state policy advisor and the program manager. Mm-hmm. That's correct.
Thanks, Maria. Another question regarding the $100,000 on the P&I guide. The question was, can you begin to incur costs as you're completing the P&I guide if the costs are if the costs fall under the $100,000 mark?
So I would just once again hold those budget questions for the webinar that we will have in December, but just remember that we have to have the budgets approved, but you can, for planning purposes, if you have a conditional approval is up to $100,000, but there are still withholdings that have to be addressed, and you do have to have an approved budget to incur cost.
Thanks, Maria. What are some other questions that folks have? All right. So it is now 12:55. It is close to the 1 p.m. mark. We did extend it. However, we extended it specifically for a Q&A session. So if folks don't have additional questions for the Q&A, we're going to close out the webinar now. For all those outstanding questions regarding the JUST grants and the grants process, we'll be following up with you on more specific information to help. And if that doesn't help, then during the December 1 orientation, we can answer, the programs team will be on the phone or on the webinar to answer more specific questions regarding your JUST grants and your budget notifications. Thanks, everyone, for joining.